Once again, welcome to my YouTube channel. Today's physiology is tomorrow's medicine. Today we are going to crack a MCQ. This is an MCQ. The question is falsely low HbA1c is seen in all except. The option A is hemolytic anemia, option B is beta thalassemia, option C recent blood transfusion, and option D iron deficiency anemia. So before going to the question proper, we will see the basic concepts that RBCs are produced in the bone marrow and released in the circulation, and the lifespan of RBCs are 120 days. After 120 days, the RBCs are destroyed in the spleen and the liver, and mainly in the spleen, which is known as the graveyard of the RBCs. And after the lifespan is over, then the new RBCs will be produced effectively by the bone marrow. Then coming next, we will see what is HbA1c. So, hemoglobin in the RBC combines with the glucose, forms the glycated or glycosylated hemoglobin. This combination of hemoglobin and glucose doesn't need any enzymes. So this process is occurring because of a process called non-enzymatic glycation. So hemoglobin and glucose combines without the help of enzymes. It can form glycated or glycosylated hemoglobin, which is called as HbA1c. So in this slide, we are going to see how glycated hemoglobin is formed. And this is hemoglobin and this is the glucose molecule. This glucose molecule combines with the N-amino terminal of the hemoglobin and forms the shift base. This is a temporary base and it undergoes an rearrangement called Amadori rearrangement and forms a stable ketoamine called as HbA1c. So, whenever there is high glucose level in the blood, depending upon the amount of glucose, the amount of HbA1c formed is directly proportional. So, increased blood glucose level will lead to increased HbA1c level. So in this picture, we are seeing this is normal hemoglobin and this is glycated hemoglobin. Here, these blue color molecules are nothing but glucose, which attaches to the proteins in the hemoglobin after prolonged exposure to elevated blood sugar. Next, to quantify the HbA1c, we are having so many assays like high performance liquid chromatography, enzyme assay, and immunoassay. Of this, HPLC is done in many laboratories. So with the help of HbA1c test, we can know the average blood glucose level of the individual for the past 2 to 3 months. The advantage of HbA1c test is it gives the average 3 months blood glucose level in contrast to the fasting or postprandial blood sugar, which will give the blood sugar of the particular day. So in this picture, we are seeing the HbA1c is an indicator of diabetes control. Within the normal blood glucose level, the blood glucose level is given here in millimole per liter. So this is the normal blood glucose level. So the normal HbA1c is below 6%. And from this picture, it is very evident that as the blood glucose level increases, the HbA1c level also increases, which is meaning there is a direct relationship between the blood glucose and HbA1c level. So whenever there is an increased blood glucose level, there will be more amount of glucose is combining with hemoglobin to form more HbA1c. So higher level of HbA1c in a diabetes indicates that blood glucose level is extremely high. So with this basic concepts, we are going to find out the falsely low HbA1c is seen in all except. So the low HbA1c will be low in all this condition, but it will be falsely low, and we have to find out in which condition high HbA1c is seen. The first option is hemolytic anemia. In hemolytic anemia, what will happen is this is a normal blood picture. In hemolytic anemia, the there are so many causes for hemolysis, and it will cause the red blood cells to have defect in the cell membrane, and it will lead to lysis of the RBCs. So whenever there is hemolysis, the lifespan of RBC is decreased. So the lifespan of the RBC is decreased. Because of this, there is less time for the combination of hemoglobin and glucose, which leads to low HbA1c level. So the first option is ruled out. The second option is beta thalassemia. We also know that in beta thalassemia there is a defect in the hemoglobin chain. So here is a healthy blood picture, and this is a picture showing the malformed red blood cell beta thalassemia. Here also the red blood cells will go for hemolysis. Again the lifespan of RBC is decreased. Here also low HbA1c level is seen. So the option B is also ruled out. The third option is recent blood transfusion. In blood transfusion, before transfusion itself, there is some storage lesion that can happen to the RBCs. So even after transfusion, some kind of hemolysis in extravascular or intravascular hemolysis may occur, which we can lead to the decrease in the lifespan of RBC. So here also low HbA1c level is seen. So this option is also ruled out. The fourth option is iron deficiency anemia. In iron deficiency anemia, if you see, this is a normal marrow iron. Whenever there is a deficiency of iron, it will leads to the iron depletion, and it leads to iron deficient erythropoiesis and iron deficiency anemia. So what is happening here is the iron stores are getting reduced, and there is no iron for erythropoiesis. So erythropoiesis is reduced. There is increased senescent red blood cells, that is old red blood cells. So lifespan of RBC is increased in iron deficiency. So there is increased time of exposure to red blood cells to glucose leads to increased HbA1c level. So from this option we know that from an iron deficiency anemia there will be increased old red blood cells which is having more time to combine with glucose, so there is increased HbA1c level. So the answer for this MCQ is iron deficiency anemia. So the falsely HbA1c is seen in all except the answer is iron deficiency anemia. So all the best. Kindly subscribe my channel for further videos. We will meet soon again with a NEET PG question. Thank you.